I am Lowell Weil Jr. I am the Fellowship Director at the Weil Foot and Ankle Institute and Head of Research. I am the Team Podiatrist for the Chicago White Sox Baseball Club. I am a Team Podiatric Consultant for the Chicago Bulls Basketball Team and the Chicago Fire Soccer Club. I've really started to utilize the TriLok brace in all aspects of my practice. In a foot and ankle practice, we see problems that occur with flat foot problems. We have problems that occur with high arch problems. And one of the real benefits of the TriLok brace is that it can address all of those problems with different modifications of the brace. So the brace was originally intended for a common problem of ankle sprains and lateral ankle instability, and it was designed to provide great support for that. And it is excellent in doing so. But the modifications of the bracing techniques allow you to take what is going to be lateral stability and reversing those braces to create medial stability. So in the cases where we have pain in the medial ankle, pain in the arch, or pain with flat foot associated with posterior tibial tendon dysfunction, this brace can be utilized in all of those areas. So instead of having to hold multiple braces in inventory in our practice, we can then reduce our inventory to just the TriLok brace, which can then cover all the different pathologies that we see as foot and ankle specialists. One of the other wonderful things about the TriLok brace is that it is versatile in that there are different components of the brace that are not permanently attached, so they can be removed or added based on specific desires of the patient or the doctor to provide less or more stability. So in certain circumstances where your patient may be less able to utilize all the different straps and brace techniques, we will eliminate those and make it more simple for the person who needs a more simplistic approach. And then for the higher level person, the higher level athlete, we can incorporate all of the different components to give that full support and stability that they need within the course of their activities and their life. Many braces provide support, whether that be medial or lateral, but while those braces may technically work, some of the problems that patients find with those braces are the materials aren't very comfortable. They're stiff materials, they're caustic to the skin, and the BioSkin products in the TriLok brace is something that is extremely comfortable for patients, and time after time we get comments about how comfortable the material is. Additionally, you have all the components of stability that can be incorporated in the brace, yet it can still fit into normal daily shoe gear. Certainly all types of athletic shoes can be utilized with this brace, but even casual shoes and even some of the more loose-fitting dressy shoes like lace shoes for men can be utilized. And for many of these people, they're not just using these braces for sporting activities, but they need them for their daily activities because they are very active individuals whose work requires weight bearing. So to have a brace that can fit into those types of shoe gear is extremely important to us and our patients. I use the TriLok brace in many different indications. Primarily for the lateral side of the foot, I will use it commonly with acute ankle sprains or chronic ankle instability that we are trying to build up strength concurrently with physical therapy. I will also commonly use it with perineal problems, perineal tendonitis, perineal weakness, perineal tendinosis, and that is one of the most effective uses in my hands for the lateral stabilization aspect of the TriLok brace. I will also use the TriLok brace for medial problems. For tibialis posterior tendon dysfunction or just posterior tibial tendonitis, I will commonly utilize the TriLok brace, and it tends to be much easier and easier to get into shoe gear than the alternative braces that are currently utilized and I've utilized in my past experiences. The combination of the different strapping techniques allow you to raise the arch while also protecting the medial side of the ankle and the tarsal tunnel area. So that combination ability is very effective for the tibialis posterior set of pathology. Occasionally I will use it on an acute plantar fascia problem where we can raise the arch and still get some compression into a swollen heel, and that can be effective. In some patients who have components of tarsal tunnel syndrome and getting some swelling down and yet protecting the medial side of the ankle and foot in tarsal tunnel syndrome, I will occasionally utilize the TriLok brace for those patients. I will commonly use the TriLok brace in my post-operative patients who require higher level protection after a reconstructive tendon procedure or some type of a rear foot osteotomy that we need to control and support the foot in a certain way to allow our procedures to start to take effect as they're going through the rehabilitation and physical therapy. In my hands, the TriLok functions much differently than an orthotic device does. The TriLok offers so much more support of the entire foot and ankle, where an orthotic has specific support within the foot and it can have some effects onto the ankle itself. But if we are looking at an acute injury, an orthotic is not going to be nearly as effective in controlling the acute injury compared to the TriLok brace, which will provide that support for an acute injury. There are many situations where we need to use walker boots in the course of our treatment, whether it be some type of an injury or post-operatively. We still utilize walker boots and they're an important part of our practice, but in certain cases of a more acute but not as traumatic of an injury, I will now find myself going to a TriLok brace where previously I didn't have much option except to go to a walker boot, and certainly the TriLok brace provides a much more functional result. Walker boots cause limb length discrepancy and hip and back pain as a result, so the ability to get something almost as supportive into a normal shoe gear is hugely beneficial to patients in those particular situations. Post-operatively, I'm finding myself moving out of walking boots more quickly because I have the opportunity to provide the support with the TriLok brace so I can get them back into normal shoe gear. And the TriLok reduces swelling much more effectively than a walking boot does. And so the quicker I can get that reduction of swelling down, the quicker we can get a more appropriate functional result. Many braces that are custom made for the treatment of some different problems, such as lateral, medial, ankle, and foot problems. Many people, and myself included, utilize things such as the Ritchie brace and the Arizona brace. Both of those braces provide excellent support and relief of problems. Unfortunately, those braces are custom made and take weeks or longer to get the device to the patient. And many times we don't have that choice. We need to get something on a patient right away. The TriLok offers nearly as good of support as those other braces do, but it's available today and immediately. It also does a better job of controlling swelling from an acute injury compared to a Ritchie brace or an Arizona brace. It does not take away the important needs for utilizing a Ritchie brace and Arizona brace in many conditions, and in many conditions you have to go to those braces. But it provides the more acute onset. In many cases in my practice, I will start by putting them into a TriLok brace while we're waiting for the Ritchie brace or the Arizona brace to be fabricated. And that can be a lag of 3 to 4 weeks. So I'll mold them for a Ritchie brace or an Arizona brace, know that it's going to take 3 or 4 weeks to get that brace, and I'll use the TriLok in turn until we get those braces available to the patient. Additional benefits of the TriLok brace over a custom brace such as a Ritchie brace or an Arizona brace is its cost. It provides nearly the same support as those other braces in many situations, yet the cost is less than 1/10 of those customized braces. With healthcare changes and more people having deductibles that they have to meet on their own, people are looking for less costly ways to provide equivalent treatment. And for sure, the TriLok brace provides a cost-effective yet very supportive alternative to the more costly customized braces. Another wonderful application of the TriLok brace in my hands is I see a lot of athletes, and some of those athletes are gymnasts and dancers who can't have shoe gear on. And so I can utilize the TriLok brace in those situations, which are also applicable to people who aren't crazy about shoe gear, and it still provides support. Although shoe gear helps it still doesn't necessitate the need of having shoe gear to get the benefits out of a TriLok brace.